Hey, greetings, friends. Jacque Howard here, and welcome to one of my podcasts. I appreciate you listening over however that is, if it's WIMG 1300, WPHY, or one of the many social media outlets where this is distributed. But remember, the best thing to do is to reach out to me via the website, jacque-howard.com or Trenton365.com. Send me a message from there, and then we can connect. Because together, it's all about building a better community for everyone. So in that realm, I'm going to be bringing on my friend Ken Wolski. Ken is a retired nurse. He's also a medical marijuana advocate, and he is the executive director of the Coalition for Medical Marijuana, which operates in the state of New Jersey and beyond. Ken Wolski, welcome to my podcast. I'm still kind of trying to figure out exactly what I'm going to call this segment. But Ken, welcome to the show, sir.
Oh, thank you so much, Jacque. It's a pleasure to be here with you again.
Excellent, Ken. So one of the things that I wanted to make sure, Ken, that people got an opportunity to hear from you a bit about your background and where you are with the medical marijuana in the state of New Jersey, et cetera. So if you could just start by giving us a little background of your professional experience, the medical marijuana, how that has worked in your life up until this point, and then some of the advocacy work that you're doing.
Sure. Thank you, Jacque. As you mentioned, I am an RN. I'm licensed in the state of New Jersey as a registered nurse. I've been an RN since 1976. So obviously I have a wide variety of clinical experiences. I've worked in psychiatric hospitals. I was a public health nurse in the city of Trenton. I worked in intensive care units and coronary care units, including at Thomas Jefferson University Hospital in Philadelphia. And for 22 years, I worked for the New Jersey Department of Corrections in a variety of capacities, ending as a health services manager at East Jersey State Prison in Rahway and at Edna Mann Correctional Facility for Women in Clinton. So I became involved in marijuana back in 1966 when I was still in high school. I did a term paper on that, and I wanted to learn more about this. So this was my very first research, and what that paper taught me was that the government was denying the medical benefits of marijuana, and they were exaggerating the dangers. So I've had that, that has been my personal experience since 1966. And in 1967, I really became an advocate for marijuana legalization. Some of my friends who just got back from Vietnam and were wounded in Vietnam were shaken down by the police for smoking pot in Cadwallader Park. And I wrote a letter to the editor and saying that, they should not be treated that way. I joined NORML, the National Organization for the Reform of Marijuana Laws, in the early 70s. And I've been a member of many marijuana reform groups ever since. I started the Coalition for Medical Marijuana in New Jersey in 2003 when I met Jim Miller, an advocate, a patient advocate. And we were instrumental in getting the original medical marijuana bill introduced into the state legislature in 2005 and seeing it through 5 years of hearings and until it passed into law in 2010. And at that time we thought our work was over here, but we realized that we just became busier, really, quite frankly. Governor Christie came on board just a couple of days after the bill was signed into law, and he said that he didn't believe in medical marijuana, and he thought it was a front for legalization. And he established a series of basically delays and impediments into the full implementation of the medical marijuana bill for the 8 years that he was in office. So we did get one victory got a couple of victories during the Christie administration, including the addition of post-traumatic stress disorder as a qualifying condition. That was the first qualifying condition, and we got that in 2018. That was we were dedicated to having that become the very first additional qualifying condition. First of all, because it was a mental and emotional condition, which all the others were physical conditions. And also because we realized that 22 veterans a day were committing suicide because post-traumatic stress disorder was so poorly managed by traditional pharmaceutical drugs. In fact, we had veterans come and testify at the legislature that, they would dump bags of their empty pill bottles saying that this hasn't helped me and only marijuana really helped me with my PTSD. The Department of Health would not honor our petition to add PTSD at the time. But so we had to go through the legislature, and the legislature added that. But Governor Christie did sign that into law. In 2014, we realized that so few patients were actually being able to take advantage of this medicine that our board of directors endorsed the legalization of cannabis in 2014. We said that legalization would be the best way to get this medicine to the most people. It would change it from the kind of practically a prescription drug, very similar to a prescription drug where you have to have a doctor qualify you, and then you have to go back and see the doctor so often. It would change it from that type of medicine to more like an over-the-counter drug where a patient could just go in and buy it like aspirin. And there are so many different diseases and symptoms and conditions that marijuana can help that when you start to delineate them, the list is almost endless. So many people really do get some type of medical benefit from cannabis, even though they think they might just be using it recreationally. So we conducted a Get Out the Vote campaign prior to the 2020 ballot question. And of course, that was successful. And then in 2021, Governor Murphy signed the legalization law and the decriminalization law, which we're very happy that he did. And now, the decriminalization was very important too, because that stopped the arrest. Over 30,000 New Jersey residents were being arrested every year for marijuana offenses, most of them for simple possession offenses. So now that's not happening. There's been a really tremendous decrease in that. And now the Cannabis Regulatory Commission is working to establish the legal industry. They're creating an entire new industry from the ground up, with no real guides to go by, and they're really creating it out of whole cloth. And we're supportive of their efforts to do this. And they have social justice as part of the central feature of this new industry that they're trying to create, which we're so proud that they have that, and also trying to recover, trying to reestablish wholeness from the damage that was done by the war on drugs, these decades of the war on drugs. So that's about where we are right now. We're very glad that the legalization has passed. We're of course very anxious to have the new industry get started with you guys as part of it. And we have some post-legalization goals too. We have post-legalization goals. So two of the main post-legalization goals that we have are insurance coverage for medical marijuana and home cultivation at least for patients in New Jersey. So
wait, Ken, hold on. Let me look around the new office of Hub 13. Are you looking at my notebook? That literally is my next two questions that I wanted to have come up for you to talk about. Insurance covering this for like prescriptions, which is something that many folks could benefit from, and also the opportunity for homegrown. But before you go into that, folks, I want you to know that I'm speaking with Ken Wolski, who is the executive director of the Coalition for Medical Marijuana. All you have to do is an internet search for his name, and you'll see lots of information about the work that he's been doing for decades, advocating for the cannabis and for marijuana, the medical marijuana space currently. Ken, so can we go into it and let's talk a bit more about the insurance portion of it and prescriptions, and then also go into the next part about home growing, et cetera.
Yeah, well, let's see, I was trying to call it up, but insurance coverage is so important. We think I'm personally convinced that this is going to help so many patients in New Jersey actually get access to it. It's going to change, marijuana. I mean, imagine spending the difference between spending $400 for an ounce at an alternative treatment center to spending $15 copay for an ounce. And there are several bills that are in the legislature right now, in the New Jersey State Legislature, that are working their way through the legislature that would provide for insurance coverage for medical marijuana. And the one that really has legs right now is S313. This would allow the cost of medical cannabis to be reimbursed by several funds: Catastrophic Illness in Children Relief Fund, pharmaceutical assistance for the aged and disabled, and Seizure Gold and the VCCO fund. So I just testified at a Senate Health Committee hearing in support of this. And the Senate Health Committee passed this bill out of committee unanimously, despite the opposition of insurance companies who testified that, oh no, we can't do this because the federal government would be opposed to it. We can't do this because it would interfere with other programs that or benefits that the patients might have. And they have a whole list of complaints, but our arguments carried the day. And we said that no, this is going to not only benefit so many different people, this kind of insurance coverage, but it's also going to decrease the cost of healthcare in New Jersey, because if you use cannabis treats multiple conditions. You don't have to take multiple pharmaceutical drugs to treat multiple conditions in a patient. You take one drug, you take cannabis, and that treats multiple conditions. Not only that, but you stabilize these conditions in a way that pharmaceutical drugs do not stabilize these conditions. With seizures, for example, this is why we passed it. One of the reasons we passed it into law was for seizure control, because so many patients were on the traditional anticonvulsant medication and they were having seizures anyway. And now with cannabis, the incidence of seizures is greatly diminished, and that's true with many other diseases too. And so, if you control these conditions better, you have fewer trips to the emergency room, you have fewer hospitalizations, and you have fewer surgical procedures. We had a young man with Crohn's disease who testified that he had his Crohn's under control with marijuana. He stopped it when he had a baby, and but he realized he couldn't even go to work because the Crohn's was bothering him so much. It was interfering with his life so much. So he started growing some marijuana in his closet. They found it growing there. The police found it growing there. They arrested him. They took his baby away from him. And they deprived him of this medicine, and he had to go for 2 major surgical procedures in his abdomen because he could not get access to the medicine he needed, the medical marijuana. So surgeries and all kinds of hospital expenses.
I want to jump back in there because I think that that's something that I want to have you come back and talk a little bit more about that, because I think that there's still a large gap between people who understand or have an understanding about what's going on with this plant and with the industry. And you've laid it out. You've touched on the medical benefits of it, how it can benefit our society from reducing costs potentially, also the social justice component of it. You just gave an example of a family that was destroyed because this person was trying to take care of their health, and they were trying to offset the cost of that health, and now they potentially could lose their child, and so on and so forth. And we haven't even really gotten into the full discussion of what the industry looks like, not just the plant touching portion of it, but all the other opportunities, what they call the ancillary opportunities for the business, and how that can really impact us. I'm a big fan of what the plant can do to our environment and helping from that perspective as well, which is just one of the numerous options that the hemp and the cannabis plant has in our society that a lot of folks have no idea about. And they're just following along, I think, blindly under this old mindset that is, many, many, many decades ago. And people like you are working to kind of advocate for that and to clear that up. Before we finish up, I want to make sure that we talk about advocacy and why it's important for not just for Ken Wolski and Jacque Howard and the other folks who we know who are doing this, but for the average person to speak up about their experience. Can you just share some thoughts about, how important it is to be an advocate?
Oh, absolutely. We say that, we're an all-volunteer organization. We would be nothing without our volunteers. What passed this into law, 5 years of hearings, 5 years of hearings from 2005 to 2010 was individual patients coming forward and telling their stories, disclosing the most intimate details of their sufferings and how marijuana helped them. This is what caused it. This is what changed it, because if one person speaks up, he's an anecdotal incident. Well, we don't have to pay attention to him. There's no science behind it. It's just a person. But if person after person after person comes and speaks and tells their story with intimate details about it, you just can't dismiss that after a while. The science, people say there isn't enough science for medical marijuana. Well, I've been hearing that since 1966. I read a magazine, and it said, "Oh well, we need more studies about marijuana before we can advocate for it." And so really, there've been over 30,000 studies regarding medical marijuana, and that are published in PubMed, and they're very, very overwhelming, convincing stories. But the thing that the federal government has been blocking research into the medical benefits of marijuana since 1970. When the Controlled Substances Act passed in 1970, they said marijuana is a Schedule I drug, and as a Schedule I drug, it is really not available you can't get it basically to study it. Unless you manipulate the system. Now, Dr. Don Abrams, a physician in San Francisco who was seeing all these AIDS patients be benefited from medical marijuana, said, well, I'm going to do a clinical study of this. And he wrote up a proposal and the FDA turned him down. He wrote up another proposal, the FDA turned him down. He wrote up another proposal saying how so many people are benefiting from it. Then he got wise and he said, I'm going to write up a proposal that says I'm looking for harms associated with marijuana. And the FDA approved that study. And then he did the clinical study and he said, well, what do you know? We found 30% of the patients did better on medical marijuana than they did on a placebo. He had to manipulate the system in order to get that done. And they still will not allow, the federal government will not allow the large-scale clinical trials to be done. And these are the clinical trials that would lead to FDA approval of cannabis. And they still will not allow those studies to be done. They have never had sufficient cannabis to conduct these studies because the only legal supply of cannabis right now comes from the University of Mississippi. And that has never had enough to do a large-scale clinical trial, even if they had the will to do it. So anyway, you have to rely on patients speaking out, essentially, to determine the benefits, the medical benefits of marijuana, and how often and how it can really help.
Mm-hmm. Hey, Ken, you just touched on something about the large-scale clinical trials, and you said it's all coming from one location in Mississippi. Yeah. Now, I don't know much about that. I hope that in subsequent conversations, I can learn more about it from you. But what would it take for, say, an ongoing or oncoming state like New Jersey, the Garden State, to say, hey, look, we want to specifically, in partnership with the Urban Agriculture Program at Rutgers, the State University, take on a large-scale clinical trial, and we're going to grow marijuana cannabis just for that. Is that something that you think advocates like myself and you and others could kind of start mentioning this on a local level to try to get something like that done here?
Yes, absolutely. Well, first of all, the federal government did say that theoretically they are now going to allow other organizations, other providers to grow marijuana for clinical trials. It hasn't happened yet, but they did give their approval and they said this is going to happen. And really, there's no reason why the states, should not be studying the efficacy of the programs that they've established. Here we've had medical marijuana available in New Jersey. Let's see, it passed into law in 2010. I believe the very first medical marijuana came in 2012. So for a decade, a good decade, patients have been having safe and legal access to medical cannabis in New Jersey. We have about 170,000 patients in the program who can access medical marijuana every month. Why aren't we doing really good studies, follow-up studies about how these patients are doing? Now there is a difference between those kind of studies and the clinical trials. The clinical trials depend on comparing the patient populations who are using cannabis with the similar patient populations who are either getting a placebo or not getting cannabis. So so there is some structural considerations to take part to take into consideration when you're designing these studies, but they can be done. They can definitely be done, and we can come up with some very, very valid information. Why aren't we doing that now? The CRC was supposed, well, not the CRC, I'm sorry. Yeah, actually the CRC was supposed to be doing some studies on these patient populations here in New Jersey, but we haven't seen them. We haven't seen them done yet.
So I have this, desire to always want to get involved and so forth. So I'm going to be talking to you personally about how I can be more involved with, what you're doing and the work that you're doing, and see how we can get the Coalition for Medical Marijuana to have a larger footprint in the networks and things that I'm a part of, because I become more comfortable with my position as an advocate, sharing about my story with medical marijuana and how it's helped me and subsequently all the other folks that are around me, because I'm in a better space, is a story that I think that more people need to hear. And I'm taking it from the component of talking to the areas where I'm already connected. The arts community, the recreation and biking and skateboarding community, as well as the faith community. And to the faith community, there's a couple of key things that I'm mentioning and building with my conversation, and you nailed them. We have to discuss the medical benefits in comparison to pharmaceutical drugs for the people who are going to faith communities. Two, if we're talking about social justice and mass incarceration and any of those things, it's going to trickle down to the war on drugs. And we're going to have to address what the war on drugs has done to these communities. And that has to be done through the faith community as well. And then also the economics, the forthcoming industry that is an opportunity there. I like to say that, if you have a congregation where people are wealthy, there's chances that all the other warm spiritual feeling things that you want to do, there's going to be some access to capital to be able to get those things done. So with me and my conversations with the faith community, it's really going to be centered around my personal experience with medical marijuana as an advocate, to talk about the medical, the social justice, and the forthcoming industry, and how we can all work together on those different things and design our future. Because I think that we're trying to do a lot of building onto something that was not structurally sound in the past. You've talked about it from the 60s when you first got involved to the 70s, all the time that you've been a professional in the medical field as an RN. And you've been fighting this fight for how long? And, we don't have enough information. We don't have enough studies. It's been 60 years.
Right.
It's a matter of willingness. And I want you to know that that you can count on me to do whatever I can to support the work that's happening with medical marijuana. Ken, before we finish up the next couple of minutes, I'd like for you to think a little bit more. I know that you're already in a progressive mindset, but I'd like for you to kind of put some thoughts out there for folks who may be entering this space, maybe trying out like just CBD topicals for pain relief and stuff like that right now. What would you like to say to them when they have questions about marijuana as medicine, or the first thing that they think is devil's weed or gateway drug or any of those other things?
Well, first of all, I'm glad to hear that you're working with faith communities, because that really it really was so sad to hear such opposition from so many religious organizations to drug policy reform for so many years, that now they're coming on board, and now we're seeing a change in their attitude, and that is so welcoming. The war on drugs has such a devastating effect on the communities. I had a firsthand look at mass incarceration. When I started working in the New Jersey Department of Corrections in 1984, there were 9,000 inmates in the state prison system. When I retired in 2006, there were 27,000 inmates in the state prison system. The inmate population tripled just in the time that I was working there. And 86% of those inmates were Black and Hispanic. And to me, that was such a terrible, terrible social injustice. And really, I thought it was. I believed that it was institutional racism. But I also came to believe that it was institutional classism, because the poor get a very different outcome in so many different areas. They get a different outcome in healthcare. They get a different outcome in the criminal justice system. They get a different outcome in where they live and the food that they eat, and just absolutely everything. And I think that the really important thing is to raise up the economics and to do away with some of the just the terrible imbalance in our financial resources between rich white people and poor people of color. So this is such an important step that we have to make to really make our society whole again. And regarding medical marijuana, first of all, it's not going to hurt you. No one has ever died from cannabis therapy. We can start with that. People may feel uncomfortable with the psychotropic effect of cannabis. Many people do, especially older adults. But there are alternatives to that. There are cannabis products that have less psychotropic effect than other cannabis products. So, talking with some knowledgeable people about this is the best thing you can do. And actually, if you sign up with the medical marijuana program in New Jersey, the very first thing that you do when you go to an alternative treatment center is you meet with somebody for sometimes up to an hour, and you discuss what products they have available, what symptoms you have, and what kind of symptom control you're looking for, and how their resources can best meet your problems. So there are resources out there, and there's obviously a great deal of information on the internet too. So people just look into it. Now we do not have to rely on the government misinformation, the government stigmatization. We can do our own fact checking, and I encourage people to do that and to do your own research on that. And certainly, I get relief. I have terrible arthritis. I just had a hip replaced 8 weeks ago, and I'm doing fine because I've had access to medical marijuana. I took very little other pain medicine. I did not need it because I had access to the kind of medical cannabis that I needed. So it can help with so many different diseases and symptoms and conditions, and it's certainly worth a try. If it's not effective for you, it's not going to hurt you.
Spot on. Spoken just like RN. Here's the facts. I'm just going to lay it out there and just let you go ahead and do the work. Ken Wolski, Executive Director of the Coalition for Medical Marijuana. Thank you so much for your time. I can't wait to chat with you more and to assist you in advocating for the plant that I like to say is the king of the forest. Thank you so much, Ken. Well,
thank you for having me, John. And we have meetings on the second Tuesday of every month from 7 to 9 via Zoom. So send us your email address if you want to get our monthly updates.
I will make sure that we get that out as well, Ken, because I'm going to start joining your meetings.
Great.
And you're welcome. And there you have it, folks. Just something simple. Another awesome human being that's coming into my life and into my network where I can ask some questions, I can gain some information and knowledge, I can cross-reference it, etc. And that's what I encourage you to do. And I encourage you to reach out to the folks who I bring to you via the podcast that is Trenton 365. I'm Jacque Howard, the voice of Black cannabis, as well as Trenton 365. Take my tour of Trenton. We'll hope to see you again and in the future. Remember, it's always about justice, peace, and humility.